Why do doctors pathologize asexuality? Imagine going to the doctor because you feel something is off, only to be told that your lack of sexual desire is a problem needing fixing. That's what many asexual people experience. For a long time, medical and psychiatric systems have seen low or absent sexual desire as a sign of something wrong. They have often labeled it as a disorder instead of recognizing it as a valid sexual orientation. This way of thinking started back in the late 1800s when early sexologists like Richard von Krafft-Ebing called asexuality a congenital anomaly or degenerative defect. They believed that not wanting sex was a sign of mental or physical illness. Sigmund Freud and his followers pushed this idea further by saying that having a satisfying sexual life was essential for mental health. They saw the absence of sexual desire as a neurosis or mental problem. In the 20th century, asexuality was officially classified as a sexual dysfunction in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. It was listed under hypoactive sexual desire disorder. This label suggested that a lack of sexual desire was a deficiency or problem that needed treatment. Doctors often tried to fix asexuality with therapies or medications, similar to how they treated other conditions like depression or anxiety. But asexuality is not a disorder. It is a sexual orientation, just like being heterosexual, homosexual, or bisexual. It means a person does not experience sexual attraction, and that is perfectly normal for them. Unfortunately, many asexual people face dismissal or misunderstanding from healthcare providers who are not familiar with or skeptical of asexuality. This can lead to unnecessary tests or treatments, making people feel invalidated or erased. From an LGBTQ+ community perspective, pathologizing asexuality keeps harmful stereotypes alive. It suggests that their identity is abnormal or wrong, which can hurt their mental health and well-being. Advocates stress the importance of recognizing asexuality as a real and valid orientation. They call for better education for healthcare workers to avoid unnecessary medical interventions and to support asexual individuals without judgment. In practical terms, doctors should see asexuality as a natural variation of human sexuality. They should respect how people identify and avoid trying to cure what is not a disease. Providing affirming care means listening to patients and understanding that not everyone's sexual desire looks the same. It also means recognizing how societal stigma can cause distress for asexual people, rather than blaming their orientation for their feelings. The legacy of outdated medical models and cultural biases has led to the pathologization of asexuality. Moving toward acceptance and understanding is essential for protecting the rights and well-being of asexual individuals. Recognizing asexuality as a normal part of human diversity helps create a more inclusive and supportive environment for everyone.